I think the big misconception is that doctors think that the technology is not for us, is not for doctors, or not for physicians, and not for health professionals. It's like a vegetative life. You are not living outside of the hospital, neither in the hospital, and that's why we need to change academia. We need to change the training of our physician. We need to change the mindset of our physician. A lot of people are afraid to be engaged and involved in healthcare innovation because they didn't challenge themselves and they didn't go out from their comfort zone. Imagine that you have a patient in a remote area and he calls you, and by assessing and evaluating his voice, he said, "Sorry, I think that you have hypothyroidism. I have the data in the system that shows that."
Join Disruptive Doctors.
I'm Dr. Selina, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. In Postcall, we dive into the untold stories of doctors who are breaking the mold, trailblazers who are redefining what it means to be a doctor. This is Postcall Beyond the White Coat.
My guest today has worn many hats: clinician, researcher, mentor, academic leader, and health tech innovator. But this episode isn't about titles, it's about the mindset. Dr. Raouf Hajji believes that beyond the clinical walls lies a world of unlimited potential. Now, he's here to tell the story of a doctor who chooses not to just follow the system, but to reshape it. Welcome to the show, Dr. Raouf.
Thank you. Thank you very much for this opportunity.
So, Dr. Raouf, beyond this resume, what does our audience need to know about you? Who is Dr. Raouf?
Yes, thank you. I'm someone who strongly believes in curiosity and lifelong learning. My passion lies in connecting with people and patient, colleague, students, and innovators, and inspiring them to see the healthcare differently. Every day, when you see my LinkedIn posts, I show up that I'm very motivated by the possibility of reinventing medicine and not just in practicing it. I enjoy mentoring others, helping them to find meaning of creativity in their career, mainly in healthcare. I am encouraging them to become part of the transformation of the healthcare. Personally, I deeply value the authenticity, kindness, and embracing change, even when it feels challenging, and usually it's the case. Ultimately, I'm driven by the goal of making healthcare more effective, compassionate, and human-centered, and more accessible for all.
So, what made you decide to pursue medicine in the first place?
In fact, choice. I'm lucky to choose medicine because this was my goal since the young age. It seems to be bizarre because I started to be interested in medicine since my early age, my childhood. My path into medicine was born from the sense of and a deep calling to serve. Even when I was a child, I was mesmerized by the human body, its elegance, its resilience, the miracle of how it heals and sustains life. Beyond this fascination, I felt something more profound: the realization that many people in my community lacked access to healthcare that they deserve. I knew even then that the being a doctor wasn't for me, and I think for most of us, it's not just a profession; it's more responsibility. At the age of 12, I began crafting my own medical journal. It's a sort of I would carefully cut out articles from health magazines, document discoveries, and dream about being a future doctor and about what the future of medicine could be. Journal became my personal treasure, my window into the world of healing, innovation, and hope. And to this day, it still sits on my bookshelf as a symbol of the patient that lit the fire in me. It reminds me why I chose this path: to blend science with compassion and to be part of the something greater than myself. And I still time to time I still check this journal, and I'm not updating it, but I see it almost maybe every year. I take a look in it, and I appreciate and I thank God, because I thank Allah because I have reached the dream that I have since my young age.
Was there any particular incident that made you the side that medicine was it and inspired you to create this journal?
Yes, in fact, it's at the age of 40, maybe. I remember that my mother left the home for 4 weeks. I don't know why. I didn't understand what's happened, but I remember that she has come. She was driven by the ambulance to home from the hospital. At that time, they explained to me what's happening, but I didn't understand. I understand it later. She has miscarriage, twins miscarriage, and this is the second time that she has it behind after me, and it was something that marked me. And later, I understand that this is because of I O positive. I have rhesus positive, and she has rhesus negative. After me, she didn't have any pregnancy, and all the pregnancy are complicated by miscarriages because of the uncompatibility rhesus. And at that time, there was no anti-D injection. And it means that I have almost seen 3 of my future brothers left behind because something that I see later that is very preventable.
Wow, it must have been scary for you, right? And I guess it carries on till today.
Yes, it's something that unfortunately it's marking my and in some part I think I feel that I'm guilty of this because of my blood group and my resistance positive. Because if it was negative, nothing happened. But this is the Allah decision. I cannot reject it.
Okay, so what was the early years like? I mean, being a when you were a doctor, you graduated in Tunisia and you served in Tunisia. What was it like your early days as a doctor?
Yes, my early years as a doctor were nothing like I had imagined it. I remember that I see a lot of American series about doctor being doctor like ER at mid age, and they were much tougher than more humbling and infinitely more transformative than any textbook could prepare for me for. Stepping in the hospital as an intern felt like being thrown into deep end of an ocean. Suddenly, weight of responsibility was real. I was no longer a student with theories. I was a doctor standing at the bedside of real people with real fear and pain and hopes. I'll never forget those long nights on call, adrenaline of emergency case, or the quiet moments after losing a patient, a human being at the age of 20 or my 20s. There were days I questioned myself, I was overwhelmed, but strangely, I never wanted to walk away from medicine because with every change comes deeper understanding of what it's truly meaning to heal, to comfort, and to serve. These early years taught me a lot that medicine is not about knowledge. It's about presence, perseverance, about purpose. It's about blending hand-on clinical skills with empathy, staying curious with every scientific update, and embracing innovation as a tool to better serve our patient. The journey with all its ups and downs didn't just make me a doctor, it ignited me to a lifelong patient to keep learning, keep evolving, and keep pushing the boundaries of what healthcare can become.
So when you said that, you mentioned when you first started working, you realized that you're no longer a student. Now you're a doctor, and the weight of the realization, the weight of being a doctor is suddenly on you. But like, what was it like? Was there any particular story, particular incident like that, really stuck with you? Like for me, I graduated in Indonesia. I remember the first time I stepped into the hospital. I had a case, I was told to clock a rabies case, a rabies patient that came in. So, as doctors, the moment somebody comes in rabies symptomatic, they're going to die. Like it's a death sentence, right? I remember the first time I walked in, and when I was told that was this case, initially I was very excited. I mean, it's like a rabies case, and this is my first case. I was so excited. I grabbed my bag. I ran into the emergency department. I was like, okay, I'm ready to take this on. It was my first case in the hospital, and the moment I saw the patient, I think everything changed because suddenly it's not a rabies case. it is a human being. It was this boy who was 18 years old and he was showing all the symptoms of agoraphobia, laryngospasm. He was just so violent. I was scared for my life because I have to clock him and he tried to lunge at me, and lucky there was a security guard. But I suddenly saw that it is not a case. It's a boy. He's got a wife. She's, because in Indonesia, they get married really young. The wife is probably 17. She's 3 months pregnant. And then the father looks at me and he's saying, you can save my son, right? He's going to be okay. And I didn't know what to do. I couldn't function. I remember looking at them and they were all looking at me because I was the only doctor there, like the intern that's been sent, they always send the intern first. So it was such a difficult situation for me. I couldn't clock properly. I couldn't talk to them. I couldn't tell them what was happening. I just told them everything's going to be okay. Don't worry, he's going to be okay. Obviously, it wasn't. He passed. He passed on at 2 a.m. that same night itself. That shook me up for a good 1 year. 1 week. Couldn't think. I couldn't function. I didn't know how to process this. The weight of that was so immense. What was it like for you?
Yes, I think one of the earliest cases that I have seen, and that has marked my career, is that one of the days of on call, I was in infectious disease department. I was called to see a patient, a woman, I think 50, at the age of 50, who has myasthenia gravis, and she has bronchopneumonia. And I remember very well, we have an ER physician, and the doctor, her husband, doesn't want to talk with the ER physician, and I don't know why he trusted me, despite it's my first year in internship. And he said to me, "Please, doctor, understand me. I know what is the situation. It's not the first time my wife need to be admitted to ICU." Told him, "Why you are saying this? Your wife is stable. Saturation is normal. Vital signs are totally normal." He said, "No, doctor. She will aggravate soon. Maybe a maximum of 30 minutes, 1 hour. She will need to be in ICU." And he told me, I have contacted the doctor. This doctor before, the ER physician, and she cannot believe me. I told you, I want to understand why you are saying this. I have experienced many times the situation, and I know that every time she has this, she needs to be admitted to ICU, and maybe she will stay weeks there in ICU. So I have the courage to discuss with the ER physician, and I told her, please try to call ICU doctor, because she's not a patient of infectious disease department. She's a patient of ICU. And I remember very well the time of the doctor of ICU is coming to admit her. The situation is aggravating, and her vital signs were really deteriorating. And she was intubated and admitted to ICU. This was marking for me, because this is first time I see that the patient and the family can be real solution for the healthcare situation of the patient if we believe them, if we understand them. Imagine that the situation at the patient, we didn't talk about with the ICU, and we didn't do the required management at time, she will die. And I remember that I have followed up this patient, and I have seen her husband several times, despite she's not my patient. I remember she was admitted, and she stayed almost 10 days in the ICU, and then she recovered, and she's fine. Because usually we feel, as a new physician, we feel that we have the wisdom and we have the knowledge of the world, and the patient and the family, they cannot understand the situation like us, because we have read books and courses, and we have been taught by the best and the most eminent doctors and physician and professor in the university and in the country. And I see at that time that we need to be humble, and we need to understand the pain and the complaint of the patient really well, because this can save their life, and this can save our career also.
I think that is so true. Like, as you're sharing all this, I'm also thinking previously as a doctor, like, I mean, when I was still in the hospital practicing, you would tell the family, this is it, and full stop, that's the end of story, because I know better. But we don't listen to them. We've stopped. I think we've gotten to a point where we're so busy, we've stopped listening to them and we're just expecting them to listen to us.
Yes, I think this is the very classical manner to perform and to work in medicine. And this is really changing because now the people are informed and they are coming with their vision about the disease and about their complaint. They can ask artificial intelligence, they can ask ChatGPT, they can Google the symptom and they come, they said they give you the list of the diagnosis, the possible diagnosis. The situation is it's much harder than before because I remember that our professors, they see that you should not lose time to discuss with the patient. Now, no, it's totally different. Now it's time, it's shared decision. We explain our vision to the patient and we explain how we see the management. And it's the patient who will decide. For example, it's usually a decision for example, we have 2 or 3 options of treatment and we explain to them that we have option 1, then we will have option 2, then we will have option 3. Sometimes the patient refuses and we cannot oblige the patient to accept your decision. You need to convince him. You need to understand what is his situation, why he's refusing, why he's accepting. Sometimes, for example, in diabetic patient, I give you the example of diabetes, is very common situation. It's indication of insulin therapy, but we cannot give them insulin therapy for this simple reason that they have no one. They have severe retinopathy. They almost blind. And they can now not have someone who can inject insulin for them. So this is, if we don't understand the situation, we'll give them insulin and they will not inject it, and they will come back with complications, acute complication. Maybe they will be admitted to ICU, and maybe we can, with the higher risk of life-threatening complication, maybe we can lose them because our robust and abnormal decision. It's usually, now it's changing. It's usually shared medical decision between us, the family, and patient.
Yeah, I think that's how do you think that we should be? I know you said we should tell them what's our vision, what's their vision. Would you say it's a lot of a change in mindset and perception? I mean, years ago, I remember if the patient ever catches you Googling, they'll say, oh, this doctor doesn't know anything, right? But now there's, like you said, ChatGPT and all, they have all the answers and they might be coming and testing you out, maybe. I mean, we don't know, right? So as a doctor, I might feel like, oh, he's probably testing my knowledge. So how do we deal with this as doctors?
I have 2 perspectives because of the patient I was seeing in Tunisia and I'm seeing now in Saudi Arabia. It's different different profiles. Usually in Tunisia, they come with complaint. They ask, doctor, I have headache and I want your advice. What should I do? In Saudi Arabia, maybe even in Tunisia, it's changed. But recently we come, doctor, please I want you to order for me city brain. And this is very, 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 very horrible because they go directly to investigation. Because when you ask them why you want to do city brain, they said because I have headache and it doesn't improve. And I have checked it on Google and I have checked it on ChatGPT, and it's explained that it can be tumor, for example, or it can be stroke, or it can be. We are now losing a lot of time to explain to the patient that there is a strategy. For example, for headache, we need to do anamnesis, to do physical examination, and then we will start by the basics of investigation. Then we will go to CT brain or MRI later. It depends on the situation. I think we should not see this as disrespect or as underestimation of our knowledge and skills. But the patient is not an inert individual. He's feeling and he's understanding, and his vision about the disease is different from ours. You cannot imagine, for example, how is awful is his headache. You cannot imagine how many sleepless hours or sleepless nights because of this headache. That's why he's checking and he's calling his friends and he's calling his family and he's asking for a question. Maybe he's during your consultation. Maybe he calls his family doctor. Maybe he calls a friend, a neurologist. And this is sometimes is not very welcome from our side. But we see this. We see this very frequently. And they see that they need the best option possible. Maybe you are not the best option, but you are the available option. So they need to look for the best option for them. You need to convince them. Maybe the next time they will not come back to you because you have decides contrary to their because you didn't obey to their orders, and maybe they will accept and they will understand your vision, and this is good for you and for the patient. And I think by this way we are losing a lot of time, a lot of money, and a lot of people, because this is a very bad approach from the patient. Because if you don't trust the doctor that you are coming to consult, you don't need to consult him. Tell the patient, please don't go from doctor to a doctor. Choose a select one that you trust and that you feel he's trustworthy, and consult with him. Don't go from doctor one to doctor two to it's not normal. Because I do the investigation. I don't check them, and you go to the other doctor who will ask for other investigation. I will not check them, and you go to and this is a loss of time, loss of money, and mainly loss of health for the patient.
Yeah, that is a problem. I think it's everywhere. So, Dr. Raouf, like, where are the places that you've worked as a doctor, like practice?
My journey in medicine, I will start by my residency. It's like rich in adventure that spanned for, consider my residency is almost more than 70 years. I think it's an odyssey that began from wide-eyed determination, evolved into a mission to serve, to teach, to innovate across borders. It all started in Tunisia in the bustling corridor of the university hospital, as most of us, where I began residency in internal medicine. The days were intense because usually we are doing on calls of more than almost 30 hours of on call, maybe once a week. It's a true initiation into the reality of the clinical care. I still remember the feeling of walking into the wards for the first time, humbled by how much there was to learn and how deeply human this profession really is. After completing my residency, I took a new challenge in Sidi Bouzid Hospital, healthcare association affiliated with the Faculty of Medicine of SUS. There, I started to serve as assistant professor of internal medicine. It was more just a job. It was a calling because this is my community. This is my region. I was caring about for underserved community while mentoring the next generation of a physician. Teaching that environment grounded me, reminded me of the power of compassion, and deepened by the belief that medicine is as much about listening as was about treating. Later, I decided to go out Tunisia and to work in Saudi Arabia, where I joined first the Ministry of Health. The scale was different. The profile of patients was different. The system was new. The challenges are unique, totally different from the Tunisian one. But the mission remained the same, to serve with integrity, adapt, and grow. It was here that I broadened my clinical lens. I navigated diverse cases and embraced a multicultural healthcare environment. Here in Saudi Arabia, it's usually a cosmopolitan environment with people from all over the world, from Arab countries, from Asian countries, from European and North American countries. It's totally different from Tunisia, which mainly is local population. Most recently, I transitioned into the private sector, working in a leading corporate hospital in Saudi Arabia. The chapter has brought to me a dimension to my journey with exposure to advancing technology, digital transformation, and patient-centered approach rooted in both innovation and ethics. 7 years in medicine and in healthcare, from resident to assistant professor, from public service to corporate care, I never stopped learning because I feel every time that I need to learn more. I need to update my knowledge. Each place, each patient, and each team I've worked with has shaped the doctor I am today. And though all my patients have for internal medicine, for medical education, and health system innovation has only grown stronger during this career.
Mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
When you moved from Tunisia to Saudi Arabia, I know you said that one is very local, the other is very cosmopolitan. What were the difficulties for you? Was it difficult and how did you adapt to it?
It's some part of there is a difficult side and the easy side. The easy side is that I'm Muslim and I'm from Arab country. Almost the most of the population there have the similar background. What was different is the approach of the patients. In Tunisia, as I have explained before, is the patient mainly they have a complaint and they wait for you to explain to them the strategy. And usually they trust you and they accept your decision. And the approach is much easier. In Saudi Arabia, the approach is different because we have the patient who are coming with their own decision and their own perspective and their own visions. And this can sometimes take a lot of time to convince them about your vision and about you need to change their vision about their disease and convince them about your vision. And then you will start the management. The other difficult situation in Saudi Arabia is that sometimes that I speak almost fluently four languages, mean Arabic, English, Italian, and French, but I don't speak the local language of for example, the Urdu or Tagalog. I don't speak them. And sometimes we have people that they don't speak Arabic, neither English, and they speak their own language. And it's very hard. We need the translator. Sometimes we find the translator in the hospital because of the population of his country, but sometimes it's difficult to understand what is his complaint, why he's coming, and he cannot understand what you are saying. You try it in English, you try it in Arabic, you try it in a familiar spoken dialect here in Saudi Arabia. Sometimes you cannot understand him, and even if you write it, he cannot understand, and you cannot understand. This is a mutual misunderstanding. And imagine the situation where the doctor and the patient cannot communicate well and they cannot understand each other. I think it's the worst situation that you can live, because you are seeing your patient suffering and you cannot help him because you don't understand what's happening to him. And you need to wait for someone who can speak his language, and maybe the message transmitted between you, it can be changed by this translator. And this is very challenging situation. Happily, it's not very, very frequent because most of them, they understand English. But when we face the situation, it's very hard. It's very challenging.
What about the healthcare system as a whole? Is there a difference?
Yes, it's different. It's different in Tunisia, despite we have a lot of skilled healthcare professionals, despite we have a good, excellent expert in new technology, we are still behind adopting technology in healthcare. We are working on this, but we are not going with the required pace. In Saudi Arabia, maybe it's much evolutive and much more advancing and progressive. In Saudi Arabia, I remember, for example, during the COVID-19 pandemic, we have telehealth communication with our patient. It's installed there, and everything. For example, here in Saudi Arabia, we have electronic health records, and still is not connected for all private and public, and this is the target. But we have electronic health record, for example, in the public or in private. All the communication is in electronic. It means you have your file, you have the prescription online, and he goes to the pharmacy. It takes his treatment without any paper use. You don't need any paper. This is paperless system, and this is very advanced and digital system. And for example, in in the private hospital I'm working with, they have a robotic pharmacy. And the system, for example, you have prescription, you prescribe drug X, and the system, they tell you that it's not available. And there, for example, there is another. It's what's more successful, and I think it's excellent. For example, a psychiatrist have prescribed for your patient 2 weeks ago treatment, and just decide to give him today another treatment. When you launch the prescription online, you have a red flag. Sorry, doctor, the patient is on the treatment of the psychiatrist, and you cannot prescribe the treatment. This is the treatment that you are suggesting now, because this is very, very, very interesting. And in Tunisia, we are going forward, but the pace is not enough. Saudi Arabia, it's much more advanced and much more digitalized.
Well, that is so impressive because even here there's a lot of polymedicine and most times you will miss out. I had patient coming in with like a whole bag of medicine and it's prescribed by a few different doctors and no one knows which is what and they're just taking everything. So what you're saying is it is so good and so advanced that it actually really helps in patient delivery and making sure that it's safe.
This is the main goal of this approach. For example, we have we have an allergy of the patient, and you didn't ask your patient, but when you see you check your file in the screen, you see that there is a red flag and there is an icon showing you that the patient has allergy and that he has, for example, developed an anaphylactic shock a few years ago in another hospital on your hospital. It's really, I think it's something simple, but it's life saving and time saving mainly. And I think it's life saving because when the patient is not conscious that the treatment given by the doctor A is contraindicated with the one that I will prescribe. And this is the situation. And maybe you are the one to blame when he's taking the treatment, he has complication. And usually it's for example, there is another way. For example, the patient has taken prescription for diabetes from another doctor 2 months ago, and the doctor has prescribed it for him the duration of 60 days, and the patient coming to check to refill the treatment at the day of, for example, 45. The system will explain to you that you cannot prescribe for this patient because he has 2 weeks forward of treatment. You don't need to, it's an extra treatment. The insurance will not accept an extra 2 weeks of treatment. And this is time saving, and this is mainly money saving.
Is this how you got into health tech? Is that is this where your exposure is and it got you into health tech?
No, my how I am going in health tech. It's started very quickly and very early in my career because I was convinced, and the thing that I was convinced 100% since my first year of medical study is that medicine is evolving, and the guidelines of today can be outdated in the next month. And this is for the guidelines, this is for the treatment, for the standard medicine, and even the technology. For example, I remember what has triggered a lot and have dramatically changed my vision for health tech. I'm interested in health tech since years, but the COVID-19 pandemic has transformed my vision about healthcare. I see that there is inefficiency in the system. There is gaps between what we learned and what a patient truly needed. That initially, I think that it can improve by time. But the situation is during the pandemic, we see that we are left behind the evolution of nature and the evolution of pandemics. And I think that I remember I was shocked during the pandemic when I have read an article published, I think it was 2007. The article is about the next pandemic. And imagine that this article says and explained scientifically by proofs. It was published by a group of Singaporean research. And it said in the conclusion, I remember very well the conclusion, that the next pandemic will emerge from China and from animals. It will be a zoonosis, and it will be very serious situation that if we are not preparing ourselves in 2007, next, it will be almost after 10 years, we will have this pandemic. And exactly what was predicted happened in 2019 and 2020. And this make me question why we don't listen to the scientists, why we don't listen to the researchers, why we don't listen to the doctors. Imagine the millions of people who died can be saved if we were prepared, if we have seen the coming pandemic. Also, during the pandemic, we see that the healthcare system all over the world, even in developed country, between parentheses, the healthcare system cracks. And the situation is impossible to ignore. I saw firsthand how fragile outdated parts of medical infrastructure were. It was no longer just about improving medicine. It was about reimagining the medicine, the healthcare system. I think there was conscious about that, but the pandemic has changed this and has highlighted the urgency and the imminence of the change. The pandemic made it, unfortunately and painfully clear, the evolution of healthcare isn't an option. It's obligatory and it's compulsory and it's urgent and it's imminent. It's urgent, it's vital, it's tied directly to the health and survival of our communities and system. It's must move forward, not only with science, but also with empathy, agility, and innovation. We see that technology is very, very quickly evolving, but the healthcare is not evolving. I think it's because of us, because of the stakeholders, mainly because of physicians. And this is, unfortunately, this is the thing that must change urgently.
Where were you when the pandemic happened? Were you in Tunisia or were you already in Saudi Arabia?
I was in Saudi Arabia, but the situation was, my eyes was opening. I remember that I see the data every day, so daily that I become depressed when I see the number of deaths and the number of patients. And I see the word data. I remember I forgot the website, but there is a website who by seconds mentioned the deaths and the cases. The situation was much better in Saudi Arabia because of technology, because Saudi Arabia was very strict in isolation. But in Tunisia, the situation was much harder. I have my colleagues in Tunisia, and I'm seeing the situation in Saudi Arabia and seeing the situation all over the world. And it was not easy. It was not easy to see people dying for something that now I'm convinced, and even before, it was very preventable.
What was it that you see could have been preventable? Because you were saying that it was happening and healthcare was not evolving fast enough. So what was it that you saw that if we had evolved, it would have, maybe saved more lives?
Yes, I think one perspective is that we need to understand even the country they are not sharing their data. We can understand that situation. And I have read an article about that, seeing that by analyzing the maps and analyzing the crowd of the hospitals in between, I think it's August, since August 219, an hospital in Wuhan in China, and in other neighborhood, the number of people and the cars during this period, it was analyzed. I don't remember which institution that has done this, but it was surprising that they said that the number of cars and the number of people in the hospital at that time was not normal at all. It was, and this can explain that the pandemic, maybe it has started earlier than it was said. It means maybe in August and September. And if we have this data before, people can the healthcare system can be prepared in the infrastructure, in the material resources, and in human resources, because we don't have enough knowledge about the pandemic. We don't have a lot of knowledge about the virus itself, but we know about the SARS itself. We didn't listen to the people who understand the situation. And I think if we have the tools of artificial intelligence, of data science, and the people, the situation can be much more predictable. And if we can predict it, we can prevent it. This is the idea. And I think the mistake that was done should not be done again in the next pandemic. And I'm sure we will have a next pandemic. Maybe, unfortunately, maybe next few years, but we need to be prepared for that.
How can it be different like this time, like knowing what we know, and you're saying with data and all, and plus now we have generative AI and now even agentic AI. So how do you think the next pandemic could be more well prepared with all this data?
I remember that I have participated in one of MIT hackathons, and that as it was in the time of a pandemic, the idea behind it was with the data scientists and data science students. The idea is to predict what will be the next strain of COVID. It means seeing the strains developing in the other countries, we can predict, for example, in Tunisia and Saudi Arabia and in Indonesia and US, what will be the next strain and how it will be virulent and how it will be contagious and how it will be treatable. It will respond to the treatment that we're given now. It was an excellent approach, But after this, we didn't finish the work, unfortunately, because we are from different countries, and the pandemic has ended, fortunately for all the world. And I think if there is huge research behind, we can predict where and when it will happen. Maybe it will not be very, very accurate, but it can help us to say and to know that this situation in which country X is showing that there is a next pandemic. And I think one of the things that was lacking during the pandemic, and this is very, very heartbreaking breaking thing, is that there is no collaboration between countries. There is no collaboration between researchers. Imagine that, for example, the situation has started with the COVID-19 pandemic in one hospital in Tunisia. And Tunisia, Tunisian authorities have declared that we have cases of for COVID-19, for example. And imagine that Europe, US, Asian countries, Arab countries, MENA region countries are working together. Please, how can we help you? We need to strict the expansion of the cases. We will help you by material. We will help you by researchers. If you need experts from our side, we can provide you. And imagine that situation was limited, and there is no expansion of the cases out of Tunisia, for example. It's easy to do this. It's easy when we have 10 cases, but it cannot be easy when we have 10,000 cases. The situation and the country, and I think every wise healthcare professional and healthcare stakeholder, if we understand that by helping each other, we can solve the situation. And the pandemic have shown that no one is safe until everyone is safe. You cannot imagine yourself as developed country. You will not have cases because this is the disease of poor countries like Ebola and like HIV. No, you can have cases and you will suffer more maybe because you're. And this is the situation. Is we need more stronger collaboration. We need more understanding, and mainly we need to listen more to our experts who are not biased, because there is a lot of political and financial bias in scientific and biomedical research. I think it's important to listen, and it's important to understand that the situation cannot change if we cannot collaborate with each other. And by your knowledge, by my knowledge, by your knowledge and my skill, by my data, we can understand the situation much better.
Is that why you co-founded the international medical community?
Yes, this is one of the idea behind the COVID-19, the international medical community. It was the situation have started when me and the second co-founder, which is Gabriela, is from Croatia. We have met in the European Union versus virus. She's expert in law and business, and me as expert in healthcare and health tech. We met as two members of the same team, and we understand that by her perspective and by my perspective and my background, that the COVID-19 pandemic is mainly there is a lack and there should be a huge shortage of collaboration between experts in different fields in healthcare. It means you can help in the COVID, because when we have the COVID-19 pandemic, it was not only the healthcare system that was broken. Even the economy was broken. All the system were broken because of this. And we understand that, like we say in Arabic, one hand cannot clap. So we understand that we need to work together to give everyone has his insights, and to create a space where healthcare engineers, innovators can meet and can collaborate together, and can have training and can have the insights of experts from different fields. For example, if you want to create a startup and you have an engineer, maybe you cannot understand what is real situation of healthcare, what is the painful points, and what are the gaps in the healthcare system that you can fill by your startup. You need a healthcare professional to help you on this. You need a business administration expert. You need economics expert. We need a law expert to develop your startup.
Okay, so what does the international medical community do? Like, I understand the purpose is to bring people together. So what else do you do within this IMC?
In IMC, we worked with with different teams from all over the world. We are a team from almost four continents, from Croatia, from Tunisia, and from Ghana, and from Mexico, and we work together in creating a space for collaboration. And we have also developed an internship program for the medical student and for the health for technology expert technology students, and we have worked with teams from out of IMC to prepare, for example, open source ventilator, to work on open source ventilators, to work on the development of new devices. And we have also worked on events that highlight the health tech system all over the world and how it needs to must change.
Okay, so I guess the COVID-19 has changed a lot of people. I mean, it's changed me as well, from someone who, I mean, we started Disruptive Doctors during the COVID-19 as well, Vivek and I. I think people start to think that, okay, maybe life is short. Start doing something that you're passionate about, and to make that difference, because there's no.
Yes.
Like, you describe yourself as a health tech futurist. So what does that mean?
The description means actively that I'm actively participating in shape what healthcare will look like, not in 20 years, next 20 years, but also starts today. I think we need to improve the healthcare systems from today, from now. The future starts now. We cannot have a better future if we didn't start. We didn't try to transform. It's about asking bold question, challenging outdated system that we are working with in healthcare. It's about building bridges between medicine, technology, and human empathy. I think the technology is really evolving, but the healthcare system is not taking profit from innovation as it should be done. It means for the health tech futurists, it means imagining a world where precision medicine, artificial intelligence, and connected devices are not futuristic dreams, but daily tools to improve lives. It's about seeing the future not as something that we wait for, but something that we co-create, because the future, as I said, starts now. This is the idea of health tech futurists. The future starts now, and we need to start now, directly now.
So what is it that we need to change right now, today onwards? What is it about medicine or healthcare that we need to change now?
I think what needs to change now, we start by ourselves, me as physician and healthcare professional overall. I think we need to see the healthcare differently. We need to understand that we are not only clinician, we are educator, we are human. We need to understand that technology is evolving and the patient needs better healthcare and accessible healthcare. And we cannot have this accessible healthcare without technology. Unfortunately, you cannot assess your patient in remote area without using your phone. You cannot access your patient without the glucometer. It's evident. Patient sometimes patient monitoring is a huge tool that we are seeing, and it's changed the life of a lot of people. If it becomes more available, it will be more accessible, and it will be much cheaper for the people that can, so everyone can afford it. And I think the main message that we need to understand is that doctors, physicians need to understand that their role for the healthcare system they are the cornerstone of healthcare system. If they cannot change, they can be left behind, and the main loser is the patient. Because sorry, go ahead.
Sorry, go on. No, my question is, why do you think doctors are not ready for that change?
No, I'm not saying that the doctors are not for this change. I'm saying that a lot of doctors, they are still thinking that they have the role of clinician and that's it. And there is a lot of doctors that are innovative, and they understand that the health tech, mainly the young generation, they understand that the health tech and the innovation is the future of healthcare. But I'm talking about part of a healthcare professional, not only physician, that they are still doing their clinical or their healthcare duty without any evolution, without understanding that the healthcare system and the healthcare is changing. The healthcare now, it has started to change, and it's evident that it's changing. And when you check, for example, can you imagine that we have glucose, for example, 10 years or 20 years ago, you cannot imagine that we can monitor the glucose for 24 hours for a patient. They cannot imagine that we can have an alarm for hypoglycemia for your father or your mother. You are living in the neighborhood. You can have an alarm for your father who has hypoglycemia at 50. You cannot not imagine this. You cannot, for example, imagine that there is a watch, smartwatch that's signaling that you have fibrillation. You cannot imagine this. And now we need not only to imagine the future, but to create it. And I think the main loser, if the doctors and the physicians and healthcare and other healthcare professionals are not involved in healthcare innovation, is the healthcare itself. The healthcare itself cannot be improved without us, without healthcare professionals.
How do you think doctors should get involved in this?
I think it's easy. First, we need to be convinced about the transformation of healthcare by technology, and it's evident. Can you imagine that we century before we are not using stethoscopes? Do you imagine that we hear we do auscultation by our own ears? And it was created a stethoscope. Can you imagine that now we can use like something device like a stethoscope that to do ultrasound. You can do directly like a smaller device like a stethoscope that can. You don't need to listen to the heart. You can see it by ultrasound directly by a small device that link it to your smartphone. If you and we I think it starts by the conviction of the need of urgent and imminent healthcare transformation. And it means if you understand, if the physician understand this, he will need to update his knowledge, update his expertise in the new technologies, even if he doesn't he doesn't want to be involved. The healthcare system needs him because, for example, I'm a founder of a startup, and I'm an engineer. I'm biomedical engineer. I understand some part of the healthcare system, but I cannot see the real field of healthcare, and they cannot see the perspective of the physician. And also, I need the perspective and the vision of the patient. It's different. It's totally different. There is a point of view and point of vision totally different. We need doctors, and we need that the mindset of doctor change. We are not only clinician, and we are not only carer and curer. We are also agent for healthcare transformation for the benefit of the healthcare system and for the benefit of patients.
Yes, I completely agree. I mean, the old days where you just come see a patient and don't do anything more, I think those days are really over. You need to start thinking beyond just, what was taught. Because I think what was taught is already outdated, right? Even our textbooks get renewed every 5 years. So what more now when with generative AI, like so many things would be so accelerated. So what do you think the role of a doctor would be in this?
I think the doctor needs to be involved in this because without their insights, the technology can be very harmful for our patients and even for us. If imagine that we are using a technology or an artificial intelligence tool that gives you a diagnosis, for example, for surgical emergency, and we are trusting this system, and we are starting operating patients according to the perspective of artificial intelligence, and this can be created an extra surgery, non-needed surgery, and an extra mutilation for our patient without any reason. I think the role of the doctor is to help the technology to be involved in the healthcare system and to help the healthcare system to take profit from the technology with the respect of human privacy and to respect of the ethics and with the respect of our patient rights and the doctors and healthcare professional rights.
Mark your calendar for Disruptive Doctors annual conference and exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Well, what do you think the next 5 years for healthcare, for medicine, with respects to technology and all its advancement? What do you see is going to happen?
I think the next few years, and I think it has started since now, the doctors and the physician, I will start by the doctor and physician, who are not adopting and who are not understanding the new technologies will be left behind, because the doctor the physician who are using new technologies like artificial intelligence and remote monitoring and that internet of medical things and data science are more empowered than the normal and the standard and the common doctors. And also the system, it will be more accessible because there is a lot of competition on technology, and we are trying to make it more accessible on the market. And I think it will be soon a lot of tools, artificial intelligence tools, monitoring system tools, sensors, smart rings, smartwatch. It will be much more available, and we see that the smartwatch is becoming much and much cheaper because of the technologies. And I think the patient will have access to technology, the doctor will have access to technology, and the healthcare system will be improved with technology. But there is a lot of risks if one is not used ethically with the respect of data privacy and data ethics.
I think this whole data privacy thing, like a lot of us are very unaware of it. How does this play out in health tech or in healthcare?
I think I see that the data that we are using now, it should be monitored by healthcare authorities and by patient communities and by physicians, because if we leave the field for technologies firms, which is very very harmful for our patient, and it's not ethical, and we need to be very vigilant. And I think one of the approaches that doctors need to be taught in universities and medical colleges about that, and they need to understand what is the black box in artificial intelligence, and they need to understand how data can be manipulated and how it can be used wisely and ethically. The doctors can be people who can help to implement ethically the tools of artificial intelligence and technologies. And I think it's started by teaching ourselves and but also by academia. I think it's important that doctors and start to work on this.
Do you think medical school is going to change their syllabus anytime soon, considering what's going on right now with the emerging of all this AI and all this tech? Do you think medical school should be changing their syllabus?
I think and I see that it's changing, but there is a lot of medical schools who are changing, but a lot of schools are left behind. And when you see the medical schools and medical colleges in US, most of the doctors, they have artificial intelligence certificates and they have data science certificates. And you see that they have they have a PhD in data science and PhD in artificial intelligence, and they are doctors and they are practicing. My vision is that the medical colleges all over the world should understand that the doctor will not replace engineer, and they will not replace data scientists, and they will not replace the artificial intelligent engineers, but they should understand how to use it, and how to use it wisely, and how to use it ethically, and how to protect our patient, and how to make the healthcare system profit from the advances and technologies. And it cannot be done easily if we don't know this, and if we don't understand how the artificial intelligence is working, how the computing quantum is working, how internet of medical things is working. And this is our responsibility as academic to start implemented curriculum of artificial intelligence for the healthcare professional, not only doctors.
So, what do you think is the biggest misconceptions that doctors have, about innovation, about AI and tech in healthcare?
I think the big misconception is that doctors think that the technology is not for us. It's not for doctors, or not for physicians, and not for health professionals. It's for engineers and innovators and entrepreneurs. It's not for us as physicians. We are clinician. We do some research. We do some publication. We see our patient, and that's it. This is the big misconception. I think if we explain to the physicians that the patients can be in harm and can be abused by the technology if we are not the guardian of this technology. And I think all the doctor will be very vigilant and will try to defend their patient. And I think this is the painful point that most of the doctor need to understand, that technology, you will never be, you can, but you will never be, will not replace the artificial intelligence engineer, will not replace the data science, but you need to understand how to use your technology, and you need to help the startups and the technology firms to work with technology and to help for the benefit of the patient and for the benefit of healthcare system.
So, what sort of mindset shift would need to happen for this, for them to embrace all this tech and to know that, okay, this is for us?
Yes, I think all the doctors understand in the academia, and I think most of our professors, they said to us, this is not the last course, and this is not the first course, and this will not be the last course. You need to learn every day, because if you don't learn every day, guidelines and the recommendation are that you are following is updated today, but the next month when you will follow it, you will be considered as doing medical error. And this is the same approach for technologies. The health, the system, the knowledge in medicine is very evolving, and the technology also. And I think we have the flexibility as physicians, and the humility that I know things, but I don't know a lot. It means I know some part of the technology and I know some part of the healthcare system, but I need to learn. I need to learn from the data scientists. I need to learn from engineers. I need to learn from entrepreneurs, and I need to learn from the legal experts, and I need to learn only from the patient, because our perspective as physicians is totally different from all the stakeholders of healthcare system. The main part that I think it's need to be understood is that we learn every day. We are lifelong learner, and that you have the possibility to continue your work as a physician if you want. You can shift your convert totally to be a health tech expert. From my side, I think it's I cannot leave the bedside of the patient. Mainly, this can be seen as a mistake, but because of the evolution of medicine. But I see that the service and the care that I am giving to the patient, I cannot leave it because of my human being, because I want to serve the patients. But also, I understand that I can serve the patient outside of the clinic by protecting them and by giving them the best advanced, innovative healthcare system and healthcare possibilities. And I think by seeing the all the side of the healthcare system, clinical skills, technology, biomedical research, and academia, we can have the best way to improve healthcare, and the best quality of healthcare can be provided to our patient all over the world.
Well, I like what you just said. We are lifelong learners, because I think there was a point in my career also I forgot that. I think it was probably very early on after you graduate, you started working, and then you're just going through the motion, going to work, coming back, and I forgot that my job is to keep learning, because everything is going to change and everything is evolving. And I think it was mostly when I left clinical medicine and I started entrepreneurship, that's when I realized, like, wow, I've literally stopped learning when I was practicing, because I think I was drowned in so much work, and there was just not enough mental strength, brain bandwidth, whatever you call it. Just could not. I didn't feel motivated. I wasn't driven. There was nothing that was driving me forward to do more. It's now that I realize that, oh, my why I'm doing this is so much bigger, and I'm so driven to do more, to learn more, so that I can provide better and really impact healthcare differently.
Yes, I think the overwhelming situation of the doctors, physician, and the burnout of the doctors, and I think the system, the classic system, is not beneficial for neither for the for the physician and healthcare professional, neither for the patient. It's not normal that a resident work for 13 hours. It's not 30 hours. This is not normal. This is unhuman. Imagine that you are working in ICU for 30 hours. It's not, totally unhuman, and you with a sleepless night. And how can you explain to this intern, this resident, that he need to do publication because he needs to improve his curriculum. How to explain to this doctor that he needs to learn about the case that he's seen in the ICU, and he needs to check what was the new updates about how to manage the severe acute asthma. We cannot do this. We cannot do this because we have a shortage of doctors. We have a shortage of healthcare professions, but we have very abusive mindset of healthcare system. And I think it's important to understand that you see the strong doctor and the he's a human. He has a family behind him. He has a sick mother. He has a sick father, and he has family behind him. And he cannot take care of his own family because of time. And he cannot learn. He cannot understand that there is a good new guidelines. 225 to 2025 for diabetes. He cannot check for the updates for asthma. He cannot check for the updates for heart failure. And it's more challenging to tell him to check for what is the role of artificial intelligence and generative and agentic artificial intelligence in the healthcare management or in the management of acute coronary disease, and how new medical devices are advanced to predict the acute coronary disease before its occurrence by hours. You cannot do this. We are very, very flexible, and we are very high intellectual, but we are human. We should stop this burnout. And I think one of the benefit of technology is that it can help us in the paperwork. It can help us in the stop this burnout issues that most of the doctors all over the world are suffering in developing countries. I understand what you are saying about work, the load of work and the flow of work when you are a clinician. And I remember one of the situation is I have worked in department where our head and the team, our seniors, are very uh, are very tough with us. They are very demanding. They don't care if we have 10 admission or we have one admission. It should be the profile should be perfect. Should have all the data of the patient. And even if you don't sleep 1 minute, when you present the patient in the morning meeting, should have all the data of all the patient, and you should know from the first patient to the sixth patient, should understand every detail of every patient. And if they ask you a question and you are not answering, this is big issue. You are not good doctor. And this is very, very bad, abusive approach of medicine. Fortunately, after this, and then imagine this is my first internship in the first year of internship, and this is very, very tough. When you go home, you go back home, you need to sleep, you need to eat and sleep. It's like a vegetative life. You are not living outside of the hospital, neither in the hospital, and that's why we need to change academia. We need to change the training of our physician. We need to change the mindset of our physician, and we need to understand that the student and the resident and the intern of today it can be my physician, my doctor, when I get older and I get sick. If we don't teach them very well and we teach them how to be empathetic, how to understand the pain from the patient, we will suffer. We will suffer because we will see bad doctors, non-empathetic doctors, and totally outdated doctors.
I think we are definitely seeing some of those. From what you're saying, I think maybe some of us should actually go that's where the role of a doctor is beyond just the clinical walls, right? Where they can actually come in and see, how can I improve the system? How can I make this better for my peers? How can I support this?
I think we can help tech. We can change the healthcare system by improving the quality of health tech and by improving the innovations, by being the voice of our patients in the technology firms and the technology startups. I think it's our perspective as a doctors advocates our patients, and I think also the patient, they need to be involved in the health tech innovation, because they are the end consumer, and that means if they are not considered and they're not taken in consideration, this is a big failure of the health tech. Whatever you can have very high technology that it's treating a big issue in healthcare, but it's not accepted by the healthcare professional and by the patient. It's a big failure. We'll invest. You see that a lot of big startups that failed because they're not responding to the needs of the patient first, and second to the healthcare professionals. They're ingenious. They have ingenious ideas, but the projects are not responding to the real need in the real field for the patients, for their families, and for the doctors and the healthcare professional and for the healthcare system. We don't need the technology to be so advanced. We need a technology that fill a gap and relevant gap and urgent gap, and it will succeed. Maybe as healthcare professional and doctors, we can show to the health tech companies and startups what is the painful issue. What are the things that need to be fixed? What are the things that need to be improved in your technology? And I think it's part of involvement is crucial, not only for the healthcare system, but also for the companies and for the health tech startups.
Okay, Dr. Raouf, how do you see yourself impacting healthcare differently?
I see I'm trying to impact healthcare by being involved in mentoring people in the healthcare system, medical student, non-medical student, engineers, by helping and giving consultation for the health tech companies, and by raising awareness among physicians and among patients about the benefits and the risks and the challenges of the innovations in healthcare system, mainly the artificial intelligence, medical things, quantum computing, and all these new technologies and precision medicine and genomics. And I think it's love. I'm trying to be like a bridge connector between different stakeholders of health tech system.
Okay, is there anything important that you think we should be talking about but we did not talk about in this podcast?
I think one of the main points, maybe we just have discussed about, but I think I need to highlight. I think I believe that most of the doctors who are not involved in healthcare system, the health tech system, and health tech landscape, they will be surprised when they start going in health tech care innovation. They will be surprised by the passion, by their own potential, but by their skills, because a lot of people are afraid to be engaged and involved in healthcare innovation because they didn't challenge themselves and they didn't go out from their comfort zone. And I think for in my experience, when I started mentoring in MIT hackathons, I was surprised that I know things that a lot of people don't know. And even me, I forgot that I know that. I forgot things that, and this is it's something very, very exciting to know that you have a knowledge that other don't know, and even yourself, you don't know that you know. And this is very philosophic, but I experienced this. And I remember that I have given insights that surprised all the people around the table in MIT hackathons, that after finishing the discussion, I'm saying what I'm saying. Wow, I don't know this. You see, because I didn't go out before my comfort zone. I mean, I didn't change my mind. I didn't change my brain to think outside of the box in the health tech. And I was surprised that I have given ideas to the people, and now they're having startups, and they're developing huge startups, and they are successful startups. And imagine the idea is one of the idea it was developed is that we can, by the voice, can predict that you can seem to be infected by COVID by your voice. And you see how many now startups are working on vocal data to predict the diseases. And imagine that you have a patient in a remote area, and he calls you, and by assessing and evaluating his voice, said, "Sorry, I think that you have hypothyroidism. I have the data in the system that shows that your voice is not normal as usual, But I think you need to go to the next laboratory to do TSH and FT3 and FT4, because I think what is shown by your voice is that you have hypothyroidism. Imagine this, and the patient cannot move, for example, 400 kilometers to come to see you. Just he will, by calling you, by using a startup or a vocal tool, artificial tool, and you have the diagnosis. We're not having surely the diagnosis, but you predict and you see that the patient doesn't need to come to you to spend a lot of his own money, because the trip for the people who have not from the remote area is not easy to go from remote area to the capitals for the university hospital to check for TSH or TF34. Imagine this. And, imagine the situation that, sorry, by hearing your voice, I remember that I think that it's better to consult the ENT, because I think that you have larynx cancer. I will not tell him to that, but I think I recommend you to go to ENT to check. Imagine this in now and in the next few years. It's very very advanced, and it's very helpful. I know that there are for I know a startup working on something like it has a tool that see by collecting data a blood that the patient has almost myocardial infarction and he needs to be transferred to second to the hospital where there is a cath lab. And you don't need to wait for to have high troponin and high CPKMB and high troponin T or I. By doing ECG, by doing some other lab tests, and you transfer him to cath lab. Sometimes you will transfer patient for nothing. Fears, money lost, time lost, and place bad ICU, CCU place bad taken for nothing. The patient has nothing. But imagine that we do this in very remote infirmary or dispensary, and sorry, we need to send you for the university hospital or for third line hospital to do cath lab, and this is very sensitive. And the people who are on the who doesn't have this high risk can wait, and they can check for the troponin after 2 hours, and they can go home if they have nothing. They don't need a cardiologist to be on their bedside. They need only family medicine or ER doctor or GP. And this is the main scope of health tech. And I remind again that doctors should understand that they have the skills and they have the potential to work in health tech's landscape, to shift if they want to convert to work only on health tech, entrepreneurship, or startups. It's good for them, and they can work in. It's not easy. I see it is very hard, but you can continue working as a doctor, as academic, as a researcher. But you can also work as a health tech consultant and health tech. You help healthcare system, and you help your patient, and you help your colleague by your insights, by your consultations.
How can doctors get into health tech if they are interested?
I think by access to the new social media is very accessible to learn new technologies, and very accessible to connect with experts. And I think connecting with people, like-minded people on health tech system, like and the groups and the communities like disruptive doctors, like international medical communities, like a lot of groups like doctor entrepreneurs. And I think it's easy to start, but the you should avoid your fear and start. I don't know what because it depends. Because some people are interested in digital health, some people are interested in remote monitoring, some people are interested in artificial intelligence, some people are interested on health tech overall, and it depends. I know that there is a lot of doctors who has left the clinical practice and they have left their academia to start their startups, and they have succeeded. And they should understand that is not usually the case, but if you want to be immersed in the health tech system, you need to start and don't be afraid. And from my side, I think it's and I think I'm open to help people to be involved. I'm open to collaborations, and I'm planning to have projects next few months, different in addition of our international medical communities. I'm trying to develop a sort of a project that gather people from different countries working on health tech, on fundraising, on research, and on training people on health tech system.
Okay, so your message is clear. Beyond clinical walls lies unlimited potential. So what do you want doctors to understand from this?
It's easy to try and easy to start. That fear is common and is very usual, and it's normal, because you are trying to go out from your comfort zone. If you want, you can keep your coat, you can stay in your clinic, but please let the community and let the healthcare system take profit from your insight and your vision. You have a lot of knowledge, you have a lot of skills. You know really how is the healthcare system. You know how what the patient need. You know what are the gaps and what are the weaknesses and what are the strengths of the healthcare system. You are the one who the system and the healthcare and the health tech need.
Okay, thank you, Dr. Raouf. That was a very, very insightful conversation. I mean, gathering all your experience, what you've done, what you've seen, I think our audience would definitely be able to benefit from this. So, guys, if this episode spoke to you, be sure to check out our Disruptive Doctors Conference that's happening this 20th and 1st of September 2025, where like-minded doctors like you come together to share ideas and impact healthcare differently. And if you're considering exploring new career paths, be sure to check out our non-clinical pathfinder. And remember to download the Disruptive Doctors app and start connecting. Now that wraps up another episode of Postcall Beyond the White Coat. Until then, I'm Dr. Selina.
Join Disruptive Doctors. Oh, oh, Disruptive Doctors.